not just any MRI, but a high quality, high resolution MRI. Know how to order off the secret menu of MRIs and get what we need from that to study the joint, the bone structures, the stem cells, the growth plates, things that aren't usually looked at by an orthopedic doctor on a regular basis.
Hey everyone, it's Jenn Foster here with the Elite Expert Insider Podcast. We're really excited today because we have an expert, a doctor in the house. Dr. Jeff Gross is with us today, and he is a spine fellowship trained neurological surgeon. So he's got a lot of credentials. He knows a lot of good stuff, and he is focusing on longevity and biohacking. And so he helps people to improve their health, reduce disease, and help them to live longer. So we're really excited. We're going to talk about a lot about stem cell and biohacking today. So welcome, Dr. Jeff.
Thank you so much. It's great to be here. I appreciate it.
Tell us a little bit about your background and, how, when did you first decide you wanted to be a neurosurgeon?
Oh, I'm sure I was dropped on my head as a child and came up with that idea somewhere along the lines, but I knew I wanted to be a doctor from a very young age. And then in high school, I knew I wanted to be a doctor who could do something with his hands, a surgeon. And I think in college with all the neurosciences and stuff, I said, wow, this is the final frontier. It has to be neurosurgery. So that was a progression. That was a path that no one could, throw me off at the time.
I love that. That's awesome. And so we're focusing today on more biochemistry, biohacking, and stem cells. Tell us a little bit about, I know that it's been around for a while, but tell us, like the person who's never heard of stem cell injections, what exactly is it and how does it benefit?
Well, look, we were created by stem cells. When we were in the womb, all our cells were stem cells. They were making us. They have the power to do that. And when we're born, we still have stem cells that help us grow. And when we're done growing, we still have stem cells in our body that help repair, heal, restore, maintain, replace until they can't do it very well anymore, whether it's because of age or inflammatory exposures or diseases or problems all relate to each other in the inflammation arena. But, the whole umbrella of what we call regenerative medicine or stem cell medicine is learning from that growth, maintenance, and repair process, using it as a strategy to help someone who can no longer repair something like an osteoarthritic degenerated joint, and sort of tapping back into that youthful healing process and applying it to an older joint that needs help.
Yeah. Yeah. I'm not getting any younger. My knees are what do you call it when you have rocks in your knees? That's happening. So I don't know if that would benefit to my knees or not, but I know a lot of people that have struggled with their knees or their shoulders or their hips, that kind of thing. Is that what stem cell would help with all of that? Stem
Potentially,
cell
we
injections?
look at every patient as an individual and work them up to make sure they're a candidate before we offer them anything. But yes, the results are better than repeat cortisone injections. The results are no less than a surgical replacement of a knee, for example, but without the risks, the big open surgery, the pain, the downtime, the rehab, all that, through a single injection, it's quite a step forward.
Yeah, it sounds like it's way different than just getting, like back in the day before this was even a thing, you would just go and get, an injection that you have to go back every 2 to 6 weeks or something, right?
It's different for everybody, but repeat a single cortisone injection may help with acute pain and inflammation. There's a role for that, but repetitive cortisone injections actually speed the degeneration of the joint.
Oh, wow. Is that true? Same with the spine too, right? Like I know a lot of people have back problems and they go get these cortisol injections all the time. Or, is that what it's called? Cortisol?
Cortisone.
Cortisone.
Really,
Okay.
it's some ramification of cortisone, but the spine is a little different because you're not necessarily putting it always into a joint. Like an epidural injection in the spine is layered on top of the nerve membrane, the nerve sheath. So that doesn't necessarily have the same ramifications. Although too much steroids in the body through any means suppresses our immune system, suppresses our ability to to fight off things that we need to fight off on a regular basis. So even people that have asthma and take a steroid inhaler as a preventative, although they may need that at times, it's probably doing them a disservice in some ways.
Right. So getting a stem cell injection, like what's the process of doing that? Like if you know you want this done, what is like the steps you need to take to know or how to get it done?
Well, I'd say our patients generally fall into most of them in two major categories. One is the structural, stuff, the joints, the spine, and we do what a doctor does. We take a full history. What bothers you? Where does it bother you? What brings it on? We examine, poke and prod, figure out where it is. Then we usually do an MRI of the structure, and not just any MRI, but a high quality, high resolution MRI. Know how to order off the secret menu of MRIs and get what we need from that to study the joint, the bone structures, the stem cells, the growth plates, things that aren't usually looked at by an orthopedic doctor on a regular basis. And then if we can match up the source of the pain and the patient's trying to avoid surgery, then we would go over an injection option. The other group of patients are fighting inflammation in their body. They either have an inflammatory problem like an autoimmune issue, an arthritis throughout their body, a rheumatoid arthritis, a thyroiditis, and diseases of aging are also diseases of inflammation and vice versa. So, coronary vascular disease, Alzheimer's disease, and some dementias, even type 2 diabetes have an inflammatory component. So we've used intravenous, regenerative stem cells and stem cell signaling factors that we call exosomes, if you've ever heard of that. And we do that. We also have younger patients, biohacking, and maybe not so young like me, where we do it IV just as preventative, just to slow the aging process of our cells. So we have some cosmetic things, some other things we do, but those two main groups are the mainstay of the regular side of regenerative medicine, of stem cells and what we have available. And you can do this here in the US. The cost has come way down. It's available. You may not hear it as much because we're not allowed to advertise it because the marketing claims yet aren't approved. But you're in Utah. I mean, they're one of the most stem cell friendly states in the nation.
Oh, nice. Well, tell us a little bit more about biohacking. I know I hear that word all the time. Tell us, what does that mean and how do you biohack and what exactly is that for? It's for longevity, right? So you can live longer?
Well, I mean, it's for health and wellness. And if you are healthy and well, you will be healthy longer and live longer healthy. So it is for longevity, whether you mean for it to be or not. And so this is just strategies and shortcuts to get the most out of something to support that health and wellness. For example, if I said to you, hey, we need to add more exercise to our regimen to be healthy, you'd say, great. Okay, I'll start going to the gym and I'll do these exercises. I'll do 3 sets of 10 of these weights and I'll run 5 miles on the treadmill. I would say, but wait, that's going to take hours, 5 times a week. We can get that benefit through a 20-minute cardio workout if it's a high intensity interval. That's a hack. I can get more benefit out of a single set of lifting, let's say bicep curls, if I do that to failure as opposed to 3 sets of 10. So there are ways to hack and learn. We've learned a lot in the last 10 to 20 years in this realm. And that's just one example, but we can do this through supplements, through diet, through fasting, through intermittent eating, through hot sauna, cold plunges, other things. So it's a set of shortcuts that you will not find at a regular doctor's office.
Right. But it's really honed in on the individual. So like you said, if they have inflammation and they're going to go to work out and do the reps or whatever, you can help them with that plan so they know. So they don't have to spend 2 hours in the gym and they can actually do the things they need to do the right way so that they can, because I know people that try and go to the gym and they don't see any results. And it's probably because they're not eating enough protein or what else? Like, I mean, a lot of times
that is a common reason. Yes. Most American adults are forced fed carbs and we do not get enough protein, and it's hard to maintain muscle mass and bone density without protein, and bone density and muscle mass are correlated with healthy longevity. And so we got to maintain those. And why do we need good bone mass? because in our bone is our marrow, our bone marrow, and in the marrow is a bank of stem cells. We need to take care of our stem cells.
Awesome. So what biohacking and stem cell injections, is those go back and forth? Like you can do them both
They
at the same
can.
time?
Stem cell type of treatments can be a part of a biohacking plan. They don't have to be. If you're doing something in regenerative medicine, stem cell side, you are an honorary biohacker of sorts.
Yeah. I love that. So I love that it's not just about like your workout plan, but it's also your diet and your nutrition, but also having people who know what they're talking about and know everything about the body, doctors helping you instead of just trying to figure it out.
Yeah, I mean, listen, a lot of biohackers do things on their own, right? They do peptides, they do things like that, and that's great. We can help guide people who want or need that. But biohackers tend to be self starters.
For sure. Let's talk about cancer. And you said the word earlier, but I don't really know what it means. Is it exomes? Exome?
Somes. So these are the small particles that come out of cells. For example, stem cell derived exosomes are the signaling, the business end of a stem cell. That's how they work. And they're 1/1000th the size of a cell. They can cross the blood brain barrier, get into the brain, nervous system. They're amazing. And they're a fraction of the cost of stem cells. So we really like them for that reason. They're the best bang for the buck in the regenerative space, if you will. But we have, and we're going to have many more things. What we do have now is an additional offering to people fighting cancer, and that's called natural killer cell derived exosomes. And if for your listeners, natural killer cells are part of our normal immune system. They're a very small percentage of our white blood cells. And their job is to go around the body and remove accidental cancer cells that we accidentally make all the time. They also remove things called senescent cells. These are older, boggy, inflamed cells that are taking up space and resources, but not contributing. And those are also called zombie cells. And NK or natural killer cells go around and remove those cells using their own special exosomes. So this is a signal from a natural killer cell to kill that cell without harming normal tissue. Well, we now have very difficult to get NK exosomes. They're hard because there are so few NK cells in the body. It's hard to get them, but we now have a source. We have them here, and anyone who may be wanting to use them in addition to a regular traditional cancer treatment, or in lieu of, who wants something natural, or even a preventative. Maybe someone that's high risk, their parents had cancer, they have a BRCA gene, maybe, or they had cancer a while back, but they want to help prevent recurrence. This is a game changing offering, and we're only getting better and better at this.
Yeah, awesome. I know one of my mentors, he had stage 4 cancer and he did a lot of stuff and doesn't have it anymore. And now he's continually doing the biohacking. So he can do what you're talking about and make sure that all those cancer cells are being killed.
Yep, good.
So
I
that's
like that.
awesome. Can you tell us, without naming names, of course, some stories of some people who have come to you and some benefits and things that they've received?
Absolutely. One of my favorite stories I tell when I'm asked this question is I have this very sweet woman who, I think she was 79 when we first met, and she came to me. She had aches and pains in all her joints. She had osteoarthritis, wear and tear, and her hobby was painting, these large river rocks with colorful art, and she would give them out as gifts. And I have one in my other room, which makes a good paperweight. Although we're not in the era of paper, I have no paper to hold down. So she gives them to the postman, whatever, and she loved to do this. She couldn't do it anymore. Her hands were just all painful. So we gave her an IV of a relatively low dose of the stem cell derived exosomes. And within a day or two, she was able to paint again. She was able to walk and exercise, and her joint, it suppressed the inflammatory burden and degenerative process in her joints. And she came back to me the week later just to check on things. And she said, well, when do I do it again? I said, well, when it wears off, you let me know.
Mhm.
She also, interestingly, as an aside, she had lifelong blindness in one eye that she didn't even report anymore. She's had it for 79 years. Why bother with it? She said she started seeing light in that eye again. And that's not something I ever expected or whatever, but I just thought it was really amazing. So 2 years
Wow,
later,
that is cool.
isn't that cool? She calls me up 2
Yeah.
years later and says, I'm starting to feel the pain again. I'm like, it lasted 2 years. That's amazing. So I said, if you're ready, come in. We did it again, and she had a great benefit. And that was about a year ago. So she's now 81 or 82, and I haven't heard from her since that second injection. So that's one. We do a lot of
I love
people
that.
with joints that are looking to avoid joint replacement surgery. So anyone told they're bone on bone, osteoarthritis, and sometimes doctors shortcut that word to arthritis, or I hate this phrase, but degenerative joint disease. That's such a garbage phrase, but doctors use it because they don't want to explain the full thing. Those are the patients that we've been helping the most. That's the low hanging fruit in regenerative medicine. Then, of course, anybody with cancer, we're just now able to offer them those NK cell exosomes.
That's really cool. I know I have a lot of friends that have type 1 diabetes, not type 2. There's a few older people that I know that have type 2 because that's their age, I guess. But can you help people that have the type 1 diabetes? I know there's a lot of different things that they suffer from. But I know, and one of them, when you mentioned eyesight, I know a lot of them they lose their eyesight a little bit or have to get glasses as they get older.
Yeah, actually, because there's an inflammatory and degenerative aspect of the overexposure to sugar, which is really what diabetes is. We have seen some benefits in using regenerative medicine intravenous to help suppress some of those things.
Okay, awesome. So you can do some biohacking with type 1
Totally
diabetics.
can.
That's awesome. That's really good. Tell us another story. I'd like to hear more stories about maybe with the stem cells injections.
Yeah, so most of what we do now is stem cell derived exosome injections because, again, they're way more affordable than stem cells. We've done some stem cell work, but honestly, the exosomes do most of the job anyway. So, with the exosome injections, we've treated people recovering from heart attack and stroke, brain injury called traumatic brain injury or TBI. Some people call that, post concussive syndrome. We have patients with autoimmune issues, chronic infections like Lyme's disease and long COVID. We had an older woman who had chronic bronchitis and she ended up being on supplemental oxygen. She had to carry around a little tank. So she was less likely to leave the house because it was a hassle. We actually did a breathing treatment with the stem cell derived exosomes, and she's been off the oxygen for over a year since then. We had someone with long COVID who lost smell and taste. We did some nasal kind of a spray, but really ended up dripping in the what's called the cribriform plate, where the fibers of the nerve fibers from the nose go up into the brain. And she had partial recovery of smell and taste. She was so bad, everything tasted bad to her. At least now she's like, it's relatively neutral. So she at least can eat again.
Yeah, that's so good that you're helping improve them. Tell people where are you? Like where can they come to your clinic and get all these wonderful services that you provide?
Well, we do most of our initial work remotely, so by video. And if anyone finds us listening to this podcast, for the first 20 people that call and mention this podcast, we'll be happy to offer you a free 30-minute conversation by video. So just reach out. Our office is called Re-Celebrate because we're celebrating the renewal of your cells, and that's RECELLEBRATE. And you can find us using that search phrase in your browser. So our website is recelebrate.com. We're on all the social media channels with that name. As far as I know, we're the only people using that name with that spelling. So it should lead you right to us. But we're located in Henderson, Nevada, which is a suburb of Las Vegas. And we only invite people here to visit us in person if there's something we can do for you personally. But sometimes we order MRIs, we order labs. We can do things remotely for you without you having to come here. So the magic of the internet.
That's awesome. And I love that you said that because, there's a lot of doctors out there who will just treat everyone even though they know they can't help them. So I love that you talk to them first and make sure it's a good fit before you make them travel all the way there, right?
100%. I
To
don't
help them.
want bad results. And that's one way to get bad results is to treat everybody, even people who aren't candidates. So no, this reflects upon me and my brand and my business. And we want, and as a physician, I have a duty to help people, right? It's part of the Hippocratic Oath, for goodness sakes.
Right. I love that, Dr. Jeff. Thank you so much for being on the podcast today. And I love your name of your company, Re-Celebrate. I think that's great. You can find his link in the show notes and you can get your free 30-minute session with him if you're one of the first 20 callers. So definitely check that out. Check out his website. And if you know someone who would benefit from this podcast, please share this podcast with them as well, and like and subscribe.
Hey, are you looking to increase your revenue, build credibility, and elevate your brand? This podcast is brought to you by Elite Online Publishing, an innovative publishing and full spectrum marketing company. They will publish and market your book to make it a #1 bestseller. Becoming an author is the best way to market your business. So contact them at eliteonlinepublishing.com today. All of their authors become #1 bestsellers.